I spoke to a doctor who told me that, luckily enough, none of his patients have died from coronavirus, but 3 of his patients have had a radically slowed down diagnosis and treatment. And he said to me that it looks like those 3 patients are going to be lost, that they're going to lose their lives. And that's replicated across the country. So for people who have symptoms of cancer, they need to get rapid access to treatment and diagnosis. I got a fair shock earlier on this year. At the start of the year, around February, I noticed I had a small scab at the top of my head, no bigger than the nail on your thumb. And now I do a bit of gardening and I keep hens, so it wouldn't be unusual for me to clock my head against a branch or something and have a scrape. But I noticed that this wasn't healing, and in actual fact, it's probably just getting slightly bigger. So around April, I got a little bit concerned about it, but we were in the middle of the lockdown at that stage. And I kind of, was of the mind, probably like a lot of other people, that, the doctors were full of really serious COVID cases, probably weren't seeing people like me. And I probably would be kind of that old style kind of attitude as well, that, I wait till I have 5 or 6 things wrong with me, save them up, and then I go to the doctor and get them all looked after at the same time. So anyways, as April passed and into May, I have a brother who's actually in dermatology, and I hadn't seen him either because of the lockdown. But finally, when the restrictions were eased, he was down in my house, he looked at it, and he said, "Peadar," he says, "you got to go get that looked at straight away." So I went to the doctor and got a biopsy of it, and 10 days later I got that phone call that people don't want to get, that it was a melanoma tumour, and that we needed to get it out fast. So a few days later, thankfully, the doctor in St. James's Hospital, they took about twice the size of a €2 coin out from the top of my head. And it was strange, they actually left that wound open for a number of weeks until the results came back from that. And I remember the day going to get the results from that, and you're waiting for the doctor to open the door, you're kind of reading all the movements of the doctor's behavior. You're trying to glean some kind of understanding of what's the likely prognosis as fast as you can, from just the tone of his voice to his small talk, to all of these things. I got middling news that day. The news was that it wasn't, the edges of the skin wasn't fully clear, so that they were going to have to go back in for more. So the summer went by, and just a few weeks ago, about 4 weeks ago now, they went back in and they took the palm of my hand, roughly in size, out of the top of my head. So, and they took a skin graft off my leg and replaced it there. I also got a node taken from my neck as well. And luckily then, about 2 weeks ago, they gave me the results of that, and that is clear around the edges, and the node looks to be clear too. So last Thursday gone by, I had a PET scan, a full body PET scan, and I'm just waiting for the results of that. And as soon as I get the results of that, I'll know, what the future holds. I'll either be on the pig's back and be okay, or I'll be still battling. So we'll know that in a short period of time, hopefully.
It's incredible. What was your first reaction when you got the news? The immediate thoughts that jumped into your head? How did you feel?
It is incredible. Like, it sounds nearly so standard at this stage, but my doctor Navin was telling me about the melanoma tumour, and it's funny. After about 5 minutes, he says, "Peadar," he says, "do you want me to talk to your wife?" And I was kind of going, "Well, why?" And it was obviously he knew that I wasn't taking in all the detail, and it's just your stomach sinks. It's like a dark cloud descends over you. And we had some experience of this in our own house already, because my wife Deirdre actually got melanoma cancer 6 years ago. So this is our second time going through it as a family. And I suppose that prepared us a little bit around it, because one, we knew what it was like to have this dark cloud descend on your family, but two, we also knew that it can be beaten too. So and that brought a little bit more hope than the first time that we had it. And to be honest, the first week or so I would have been very focused on it, but the job that I'm in, the leader of a new political movement, that job sucks you in to the work very quickly. So I got very busy again very quickly, and that probably stopped me stewing about the issue. there was a couple of nights now where you definitely find yourself awake at 3 o'clock in the morning and you're asking yourself questions about, what am I going to tell my kids? You know what I mean? Do I tell them the full gravity of the diagnosis, or do I ease them in, etc.? And so you do have to look at some of those existential questions too.
Speaking of existential questions, did it change your outlook on life at all? Did it make you think about some of the bigger questions that maybe you hadn't considered or that hadn't been on your mind as much?
Well, I suppose it did. The day that I came back from the good news from the last operation, I live beside the Hill of Tara, and myself and my wife went for a walk around the Hill of Tara, and I realised obviously that I have a young family. I've got 4 young kids between the ages of 4 and 9, and I realised, I suppose, that I'm going to have to make sure, obviously, that this political project that we're involved in, that it remains on the track and that it develops and grows into the future. But I'm going to have to make sure that I spend time with my family too. And also, I suppose the last 3 or 4 years for me have been phenomenally busy because, one, I had the abortion referendum in which I was one of the campaigners looking for a right to life result from that. 2, I was in a political party for about 21 years. And that came to an end because of, I suppose, the rigidity of that political party, which in itself was a very big and difficult hurdle that I had to go through. 3, then we set up this new political movement, AIM 2, over the last 18 months. And I've done, in the space of 12 months, I did 56 public meetings around the country. So you were literally on the road, every second night from, Kerry to Cork. I remember in one of those elections, canvassing in Letterkenny in the morning, at lunchtime canvassing in Omagh in Tyrone, at 4 o'clock canvassing in Navan in Meath, and then speaking at a dinner dance in Cork that evening. And I remember when I got down there, the lady at the hotel says that there are 2 beds in your room for yourself and your driver. I laughed because obviously I drive myself. Do you know what I mean? So that type of work rate is a work rate that I suppose isn't fully sustainable into the future. But thankfully, the movement has grown so much in the last while that we have good organizations now across the country. We have many new young people taking on roles of responsibility within AIM 2, and there are more shoulders now to carry that burden into the future.
Well, speaking of that, maybe you could talk a little bit about how your colleagues in the party have reacted, and how did they feel when you told them the news?
Yeah, I suppose people were shocked as well. When you have a party with one TD, the last thing you want, I suppose, is that TD to have a diagnosis like this. But people rallied round, and I have to say I was delighted. I got so much support from members of the party and just from the general public as well. And even the day that I went for the operation, I remember just before being wheeled down into the theatre, I was looking at the phone and you were just going through the messages of support, etc. And that was a tonic because it just kept the mind distracted from the impending operation as well. So massive support with regards to that. We in AIM 2, I suppose, have been very focused on developing organizational structure over the last 18 months. I know from my political activism over the last 25 years that organizational structure is absolutely key. And easily 30 to 40% of my energy goes into building that organizational structure. But it pays dividends radically because right now we have really good organization from Cork to Belfast, and it means they become self-sustaining. They have their own momentum. So even if you're out of the equation for a couple of weeks, the movement doesn't stop. It still keeps going forward.
Absolutely. So maybe then pivoting to the political side of things. Obviously, we're living in a very interesting time as regards health. Needless to say, the COVID-19 lockdown has impacted the way we view health and the way we attend a hospital and GP appointments and everything like that. What do you think, having gone through this experience, the impact has been on things like screenings for cancer diagnoses and all the rest of it?
Well, I suppose there's a number of reasons why I decided to go public with this in the first place. I was between 2 minds, to be honest. But the first reason was just, the very basic reasons about skin cancer. So right now, melanoma cancers have tripled in the last 20 years in this state. There are about 160 people who are dying of melanoma every single year. And most of those are actually preventable with very, very simple things. Getting to the doctor fast, and using, sun cream and hats, It's funny, I remember brushing my teeth when I got the news for the first time. And I was just thinking that, brushing your teeth morning and evening is so ingrained in our behavior at this point. Everybody does it. But you'll never die of rotten teeth. Do you know what I mean? Yet most of us would actually not wear sun cream on most occasions. And yet that has, a life and death threat. So we need to get people wearing far more sun cream and hats, etc. The other reason why I decided to go public on it was because I'm very, very aware that access to healthcare, especially for cancer patients at the moment, is massively restricted. So people who have cancer symptoms, who maybe have coughs or wheezing or blood from their lungs, or pains and aches elsewhere, these people are not getting the diagnosis in time, many of them, and they're not getting the treatment that they need in time. And I spoke to a doctor who told me that, luckily enough, none of his patients have died from coronavirus, but 3 of his patients have had a radically slowed down diagnosis and treatment. And he said to me that it looks like those 3 patients are going to be lost, that they're going to lose their lives. And that's replicated across the country. So for people who have symptoms of cancer, they need to get rapid access to treatment and diagnosis. And secondly, we've had a 6-month period where most screening has actually been stopped or has radically reduced in capacity. So bowel and cervical cancer has stopped, and it's back up and running thankfully now, but it's still dealing with the waiting lists that have happened. And then breast check hasn't happened as of yet. And it's mad that you can get your hair cut in this country. You can be in the physical space of a barber, but you can't actually be in a physical space with regards to getting breast check. It does not make sense to me. So literally Ain2, since late April, have been involved in a campaign, raising it over and over and again to the political establishments in Fianna Fáil and Fine Gael that we need to get the health service up and running. And it's not just cancer services. Mental health services are critical too. Right across the country, you'd have people who are suicidal, who have suicidal ideation, who have very significant mental health threats. And many of those people cannot get face-to-face, in-person consultations with their counsellors, with their psychiatrists, etc. Again, that's wrong. People with stroke, with heart disease, these services need to be up and running. COVID is a threat. There's no doubt about it. And I get, as you can imagine, emails and WhatsApps and messages from Facebook from the whole spectrum of opinion on the issue of COVID, from people who don't believe it exists whatsoever to people who believe that everything should be shut down right now. What I would say to people is, we don't know what the future holds. So absolutely we need to be cautious and careful. We need to do the simple, low-hanging fruit stuff, keeping our distance, working from home where possible, and being very, very careful. But we also need to have balance. We need to have a measured response to it. We need to make sure that other key aspects of society and life function too. And primary there is the issue of the health services up and running. So we have a petition at the moment online. We have a campaign that we're running to get the hospital services open. We also believe that there are other aspects of Irish society that need to function too. So we were the only political party at the start, I suppose, that had the confidence to come out and say, open the pubs. And the pubs have a very important aspect of socialisation, of keeping people connected, especially in rural areas. And we wanted to make sure that rural pubs were open so people from rural communities, especially farmers, who might not talk to another living soul for the whole day, would be able to get in and speak to individuals and talk to them about life. Because, that human engagement is really important for mental health. It's really important for well-being, and it needs to happen too. Sport, really, really important. We wanted to see sport, and we campaigned for that up and running. enterprise and work, we need to see that functioning. For me, there is this balance that needs to happen for us, yes, to be aware of making sure that we do our best to keep the COVID figures down, but also to make sure that we live with the illness. This is going to be around for a while, and if we don't get to some level of ability to live with it, it's going to do enormous damage, both psychologically, with regards to health, and with regards to the economy as well.
Absolutely. Well, thank you so much, Pat. I really appreciate it.